Assalamu alaikum everyone. I hope you are all good. My name is Muhammad Hassan Islam and my presentation topic is Hydrocodone and Oxycodone, which is submitted to Dr. Hamad Majid, and my department is PS Biotechnology and my ID is 22014231012. Here are contents of my presentation topic, which is Introduction to Hydrocodone, chemical structure of hydrocodone, synthesis and formulation of hydrocodone, pharmacology of hydrocodone, medical use of hydrocodone, and etc., which I will describe briefly. Introduction of hydrocodone. Introduction. Hydrocodone and oxycodone are both scheduled to semi-synthetic opioids presented to relative moderate to serve pain, and chemically they are very similar. They work by binding to opioid receptor in the brain to disrupt pain signals. Each drug slows down breathing and digestion. Opioids. Here, what is opioid? Opioids are a class of drugs that can act on the opioid receptor in the brain and body to produce pain relief and feelings of euphoria. They are derived from or chemicals similar to compounds found in opium poppy plant. Opioids can be either naturally occurring, semi-synthetic, or fully synthetic. These drugs are commonly prescribed by healthcare professionals to manage their pain, such as after surgery or for chronic pain conditions. Some commonly non-prescription opioids include morphine, oxycodone, hydrocodone, and fentanyl. Opioids can also obtained illegally, such as heroin, which is illicit opioid. Hydrocodone. Hydrocodone is an opioid agonist used as an analgesic and antitussive agent. Hydrocodone, also known as dihydrocodone, is an opioid used to treat pain and as a cough suppressant. Here, what are analgesics? Analgesics are medications that relieve pain, unlike medication used for anesthesia during surgery. Analgesics do not turn off nerves, change the ability to sense your surroundings, or alter consciousness. They are sometimes called painkillers or pain relievers. What is antitussive? An antitussive is a medication often recommended for the treatment of cough and associated respiratory tract disorders. In enantiomer, deoxytrypsin presents an analgesic effect. Chlorpressatine. Chlorpressatine is a cough suppressant that acts as on the central nervous system. Introduction to hydrocodone. Hydrocodone is a semi-synthetic opioid medication that is commonly prescribed for the relief of moderate to severe pain. It is one of most frequently prescribed opioids in the United States. Hydrocodone is typically combined with other analgesics such as acetaminophen, as in Vicodin, or Norco or ibuprofen as Vicroprofen. Hydrocodone works by binding to a opioid receptor in the brain and spinal cord, which has to block pain signals and provide pain relief. It also has the potential to cause feelings of euphoria and relaxation. Hydrocodone is available in different formulations, including tablets, capsules, and syrups. The dosage strength and the specific formulation depend on the prescribed medication. The combination product containing hydrocodone are often prescribed for short-term pain relief such as after surgery or for acute injuries. As an opioid, hydrocodone carries a risk of dependence, misuse, and addiction. Misuse of hydrocodone can lead to serious health consequences, including respiratory depression, overdose, and death. It is essential to take hydrocodone exactly as prescribed by a healthcare professional and to follow the recommended dosage and duration. If you have any concerns, questions about hydrocodone or its use, it is important to consult with the healthcare provider or pharmacist for accurate information and guidance. Here is the chemical structure of hydrocodone, which is shown below. Here, sorry. Hydrocodone is a semi-synthetic opioid compound derived from codeine. It is chemically known as dihydrocodone and is structurally related to other opioids such as morphine and oxycodone. The chemical structure of hydrocodone consists of polycyclic coil with several functional groups attached. Let's break it down. core structure. The core structure of hydrocodone is a morphinal and skeleton, which is complex polycyclic structure composed of three rings fused together. It includes a central six-member ring known as the morphinal ring system. Hydroxyl groups hydrocodone has two hydroxyl OH groups attached to the morphine ring system. One hydroxyl group is present at the C3 position while the other is attached to the C6 position. These hydroxyl groups play a role in the interaction of hydrocodone with opioid receptors. Methyl group. A methyl CH3 group is attached to the C7 position of the morphine ring system. This methyl group distinguishes hydrocodone from codeine, which has a hydrogen atom at the same position. Ester group. Hydrocodone contains an ester functional group COO linked to the C6 hydroxyl group. This ester group is responsible for the semi-synthetic nature of hydrocodone as it is adding during the synthesis process. The specific arrangement and presence of these functional groups contribute to the pharmacological properties and effects of hydrocodone. It interacts with opioid receptor in the brain and spinal cord to produce analgesic pain relief and other effects associated with opioids. Please note that discussing the synthesis or production of controlled substances is strictly prohibited, and it is important to use medication only as prescribed by healthcare professionals. Here is the synthesis of hydrocodone. Hydrocodone is a 4,5-oxy 3-methoxy and methyl 6-oxomorphine is a compound that is chemically related to morphine and codeine. Hydrocodone is synthesized by the isomerization of codeine using a palladium or platinum catalyst. This drug has also been suggested to be synthesized by the hydration of codeinones and by oxidation of dihydrocodones. Here is the structure of them. Hydrocodone exhibits extract analgesic and antitussive properties which make up its primary clinical use. It may cause dependence and addiction. Synonyms for this medication are decoded, reducing, and vicodin, and others. Here is the pharmacology of hydrocodone. Hydrocodone acts as an opioid analgesic, meaning it binds to opioid receptor in the brain and spinal cord to produce its pharmacology effects. Here are some key aspects of the pharmacology of hydrocodone. Opioid receptor binding. Hydrocodone primarily binds to mu opioid receptor in the central nervous system. By binding to these receptors, it inhibits the transmission of pain signal and produces analgesia. Analgesic effect. Hydrocodone is primarily used for its pain-relieving property. It can provide relief from moderate to severe pain by reducing the perception of pain in the brain and altering the body response to pain. Euphoria and sedation. Hydrocodone can produce feelings of euphoria, relaxation, and sedation due to its effect on the reward pathways in the brain. These pleasurable effects can contribute to its potential for misuse and addiction. Respiratory depression. One of the significant risks associated with opioids, including hydrocodone, is respiratory depression. High doses or misuse of hydrocodone can slow down breathing, which can be dangerous and potentially life-threatening. Cough suppression. Hydrocodone also has antitussive cough suppression properties. It affects the cough reflex in the brainstem, reducing the urge to cough. Gas- Gastrointestinal effects. Hydrocodone can cause constipation due to its effects on the gastrointestinal tract. It reduces gut motility and can lead to slow digestion and decreased frequency of bowel movements. Tolerance and dependence. Prolonged, prolonged use of hydrocodone can lead to the development of tolerance, requiring higher doses to achieve the same level of pain relief. It can also lead to physical and physiological dependence, where the body becomes reliant on the drug, and withdrawal symptoms may occur upon discontinuation. It is important to note that hydrocodone should only be used as prescribed by healthcare professionals and the dosage and duration should be closely monitored. To minimize the risk associated with opioid use, Regular communication with a healthcare provider is crucial for managing pain effectively and ensuring the safe use of hydrocodone. Here is the medical use of hydrocodone. Hydrocodone is primarily used for its analgesic pain relieving properties and is prescribed in medical settings to manage moderate to severe pain. Here are some common medical uses of hydrocodone. Pain management. Hydrocodone is often prescribed for acute pain such as post-surgical pain or pain resulting from injuries. It can also be used for chronic pain conditions when other non-opioid medication or treatments have not provided sufficient relief. Dental procedures. Hydrocodone may be prescribed to manage pain after dental procedures such as tooth extraction or root canals. Chronic pain conditions. In some cases, hydrocodone is used for chronic pain conditions such as cancer-related pain or severe pain for conditions like osteoarthritis or fibromyalgia. However, due to potential for dependence and addiction, it is typically used continuously and for short-term periods or when other options have been exhausted. Cough suppression. Hydrocodone-containing medications often combined with other active ingredients such as anesthesias. It can be prescribed to suppress persistent cough that is not responding to other treatment. It is important to note that should only be used under supervision of healthcare professionals according to their prescribed instructions. The dosage and duration of hydrocodone treatment should be carefully determined based on the individual's pain severity, medical condition, and risk factors. Regularly communication with the healthcare provider is essential to assess the effectiveness of treatment and manage any potential side effects or concerns. Here is mechanism of action of hydrocodone. The mechanism of action of hydrocodone is similarly to other opioid analgesics. It is primarily act by binding to specific opioid receptor in the central nervous system, producing its therapeutic effects. Here, breakdown of its mechanism of action. Opioid receptor binding. Hydrocodone primarily binds to mu opioid receptor, which are found in various regions of the brain and spinal cord. This binding activates the receptor, leading to the modulation of pain perception. Pain modulation, activation of mu opioid receptor by hydrocodone inhibits the transmission of pain signals in the central nervous system. It reduces the release of neurotransmitters involved in pain signaling, such as substance P, and inhibits the activation of pain pathways. This process ultimately results in pain relief. Reward pathway activation. Hydrocodone also acts on the reward pathway in the brain, leading to the release of dopamine and producing feelings of euphoria and pleasure. This effect contributes to its potential for misuse and addiction. Central nervous system depression. Hydrocodone has a depressant effect on the central nervous system. It can cause sedation, respiratory depression, and drowsiness by reducing the activity of neurons in the brain and spinal cord. Cough suppression. Hydrocodone has antitussive properties and can reduce coughing. It acts in the brainstem to inhibit the cough reflex, providing relief from persistent coughing. It is important to note that the precise mechanism of hydrocodone action and its effects on different systems in the body are still areas of ongoing research. The blinding and activation of a receptor contribute to its analgesic and pharmacological effect, but it also carries potential risk and side effects, particularly when misused or taken in high doses. The use of hydrocodone should be strictly under the guidance of prescription of a healthcare professional who can assess the appropriate dosage, duration, and monitor for any potential adverse effects. Here is pharmacokinetics of hydrocodone. The pharmacokinetics of hydrocodone refer to its absorption, distribution, metabolism, and elimination within the body. Here are the key aspects of hydrocodone pharmacokinetics. Absorption. Hydrocodone is well absorbed from the gastrointestinal tract after oral administration. Its absorption can influenced by factors such as the formulation of the medication, presence of food in stomach, and individual variations. Peak plasma concentration of hydrocodone are typically reached within 1 to 1.5 for after oral injections. Distribution. Hydrocodone is distributed throughout the body, including the central nervous system. It rarely crosses the blood-brain barrier, allowing it to distribute to other tissues such as muscle and fat. Metabolism. Hydrocodone undergoes extensive metabolism in the liver through processes primarily mediated by the enzyme CYP2D6. It is metabolized into its active form, hydromorphone, which contributes to its analgesic effect. However, other metabolites such as hydrocodone and or oxycodone are also found, but have weaker opioid activity. Elimination. The elimination half-life of hydrocodone can vary among individuals, but is generally around 3 to 4 hours. It is primarily eliminated through the kidneys with approximately 90% of the drug and its metabolites excreted in urine. A small portion of the drug is excreted in feces. Factors such as liver function, genetics, and drug interaction can influence the pharmacokinetics of hydrocodone. For example, individuals who have impaired liver function may experience a prolonged elimination half-life of hydrocodone. It is important to note that pharmacokinetics of hydrocodone can be altered in certain populations such as the elderly or those with liver or kidney impairment. Dosage adjustment and close monitoring may be necessary in such cases to ensure safe and effective use. As always, it is crucial to follow the prescribed dosage and instruction provided by a healthcare professional to maximize the benefit and minimize the risk associated with hydrocodone use. Here are side effects and risks. Hydrocodone, like other opioids, carries certain risks and can cause side effects. It's important to be aware of these potential effects when using hydrocodone. Here are some common side effects and risks associated with hydrocodone. Common side effects: constipation. Hydrocodone can slow down bowel movements and lead to constipation. Increasing fluid intake, dietary fiber, and physical activity can help manage this side effect. The C and vomiting. Some individuals may experience nausea and vomiting when taking hydrocodone. Taking the medication with food or adjusting the dosage timing may help alleviate this side effect. Drowsiness and sedation. Hydrocodone can cause drowsiness, dizziness, and impaired cognitive function. It is important to avoid driving or operating heavy machinery while under the influence of hydrocodone. Dry mouth. Hydrocodone can cause a dry mouth sensation. Maintaining good oral hygiene and using sugar-free gum or lozenges can help manage this side effect. Itching. Some individuals may experience itching or skin rash as side effect of hydrocodone. Respiratory depression. One of the most significant risks of hydrocodone use is respiratory depression, where breathing becomes slow and shallow. The risk increases with higher doses concurrent use of other respiratory depressants such as benzodiazepines or alcohol, or in individuals with underlying respiratory conditions. Severe respiratory depression can be life-threatening and require immediate medical attention. Dependence and addiction. Long-term use or misuse of hydrocodone can lead to physical and physiological dependence. This means our body becomes reliant to on the drug, and sudden discontinuation can lead to withdrawal symptoms. Addition, hydrocodone carries a potential for addiction, especially when used improperly or higher doses than prescribed. Is increased for risk. Hydrocodone can cause dizziness and impair coordinate, increasing the risk of fall, particularly in older adults. Other effects, less common side effects of hydrocodone may include confusion, mood changes, difficulty urinating, described libido, and changes in blood pressure or heart rate. It is important to use hydrocodone only as prescribed by a healthcare professional. Follow the recommended dose and communicate any concerns or side effects to your health provider. They can help monitor your response to the medication and adjust as treatment as needed. If you experience side effects or have concern about hydrocodone, you seek immediate medical attention. Current application of hydrocodone. Hydrocodone is primarily used as an analgesic and is commonly prescribed in medical settings for the management of moderate to severe pain. It is typically used in following application. Ac- Acute pain management. Hydrocodone is often prescribed for acute pain relief such as post-operative pain after surgical procedure, trauma-related pain, or pain following dental procedure. Chronic pain condition in certain cases, hydrocodone may be prescribed for chronic pain management, especially when other non-opioid medications or treatments have not provided sufficient relief. Where the use of hydrocodone for chronic pain is typically carefully evaluated and monitored due to risk of dependence, addiction, and other side effects. Cancer-related pain, hydrocodone can be used to manage pain associated with cancer, particularly in cases where other pain management strategies are not effective. It may be prescribed as part of comprehensive pain management plans for individuals with advanced stage cancer. Cough suppression. Hydrocodone often combined with other active ingredients such as antihistamines can be found in certain cough medications. It acts as anti-tussive cough suppressant. By inhibiting the cough reflex in brainstem, it is important to note that the use of hydrocodone should be carefully considered and evaluated by a healthcare professional due to the potential risks and side effects associated with opioids, including hydrocodone alternative treatments and non-opioid options are often explored. First, for pain management, the specific application hydrocodone will depend on the individual conditions, pain severity, and response to other treatments. Here is the topic hydrocodone is ended, and now I am going to tell you about oxycodone. What is oxycodone? Oxycodone is a potent opioid analgesic medication used for the management of moderate to severe pain. It belongs to the class of drugs known as opioid agonist analgesic. Analgesic is a type of medication or treatment that relieves pain. It is commonly referred to as painkiller. Analgesic work by blocking or reducing the perception of pain signals in the body, thereby providing relief from pain. There are different types of analgesic, including non-opioid analgesic and opioid analgesic. Now I will tell you about non-opioid analgesics. What are non-opioid analgesics? Such as non-steroidal anti-inflammatory drugs like ibuprofen or acetaminophen work by reducing inflammation and inhibiting the production of pain-causing chemicals in the body. Opioid analgesics, on the other hand, work by binding the two opioid receptor in brain and spinal cord, reducing the transmission of pain signals and altering the perception of pain. Example of opioid analgesics include morphine, oxycodone, and codeine. Analgesic can be used to manage the different types of pain, including acute pain resulting from injuries or surgeries, as well as chronic pain caused by conditions like arthritis, cancer, or nerve damage. The choice of analgesic depends on the type and severity of pain, the individual medical condition, and any contraindications or allergies. Introduction to oxycodone. Oxycodone is a powerful opioid analgesic medication that is commonly prescribed for the management of moderate to severe pain. It is derived from thebaine, an alkaloid found in the opium poppy plant. Oxycodone is known for its potent pain-relieving properties and is available in various formulations, including immediate release and extended release formulation. Oxycodone works by binding the opioid receptor in the brain and spinal cord, which helps to block or reduce the transmission of pain signals. This alteration is in pain perception provides relief for individuals suffering from pain. In addition to its analgesic effect, oxycodone can also produce feelings of euphoria and sedation due to its interaction with the brain reward system. Due to its effectiveness in managing pain, oxycodone is commonly used after surgical procedures for cancer-related pain and severe pain. Huh. Caused by conditions like osteoarthritis or neuropathy, it can provide much needed relief to individuals experience acute or chronic pain that is not adequately controlled by other less potent analgesics. However, it is important to know that oxycodone carries a risk dependence addiction and misuse. It is classified as a Schedule 2 controlled substance indicating its high potential for abuse. Therefore, oxycodone should only be used under the careful supervision and prescription for a healthcare professional. Closing monitoring of the patient response, dosage adjustment, and adherence to prescribed guidelines are essential to ensure the safe and appropriate use of oxycodone. It is crucial to have open communication with the prescribing healthcare provider, follow the prescribed dosage, and report any side effects or concerns for the understanding the benefits and its associated with oxycodone can help individuals make informed decisions regarding its use as part of their pain management plan. Chemical structure of oxycodone. Here is the chemical structure of oxycodone. In the chemical structure of oxycodone, there are several components. Benzene ring. The structure of oxycodone contains a benzene ring represented by a hexagonal shape in the diagram. The benzene ring provides stability to the molecule and is a common feature in many organic compounds. Hydroxyl group. Attached to the benzene ring, there is a hydroxyl group OH on the left side of the molecule. This hydroxyl group plays a role in pharmacological activity of oxycodone. Ester group OCO-CH3 connected to the benzene ring on the right side. There is an ester group the this ester group is involved in metabolism of oxycodone in the body. Methyl group CH3. The chemical structure of oxycodone is several methyl group represented by the CH3 groups in the diagram. These groups are attached to carbon atoms and contribute to the overall structure and stability of the molecule. The specific arrangements and composition of these components give oxycodone its unique chemical structure, which is important for its pharmacological properties and interactions in the body. Synthesis and formulation of oxycodone. The synthesis of oxycodone 4, 5 epoxy and 3 methoxyl 14 hydroxy and methyl 6 of oxomorphine from 14 hydroxycodone was described above. It can also be synthesized in other ways, for example, by the oxidation of codeine using sodium dichromate in acetic acid, and is also a structural analog of morphine and codeine. Here is the structure. Oxycodone is available in various formulations to meet the different needs for pain management. The formulation of oxycodone manufacturers is release profile, duration of action, and its administration route. Here are some common formulation of oxycodone. Immediate release and tablet capsule. Immediate release oxycodone formulation provide rapid pain relief. These formulations release the medication quickly upon ingestion, allowing for fast absorption into the bloodstream. Immediate release oxycodone is often prescribed for acute pain management or for breakthrough pain in individuals already on an extended release formulation. Extended release and tablets and capsules extended release formulation of oxycodone are designed to provide prolonged pain relief over an extended period. These formulations release the medication slowly and steadily, maintaining therapeutic levels of oxycodone in the bloodstream for an extended duration. Extended release oxycodone is typically prescribed for chronic pain management, allowing for round-the-clock pain control and reduced frequency of dosing. Combination formulations. Oxycodone is sometimes formulated in combination with other medications to enhance its analgesic effects or addresses a specific pain condition. For example, oxycodone may be combined with acetaminophen. Paracetamol is a single formulation such as percocet or endococet to provide a synergistic and analgesic effect. Oral solution. Oxycodone can also be formulated as an oral solution, which is liquid form of the medication. This formulation is commonly used for individuals who have difficulty swallowing tablets or capsules, such as pediatric patients or those with certain medical condition. It is important to note that the specific formulation and availability options may vary depending on the country and pharmacological manufacturing. The choice of formulation depends on factors such as the type and severity of pain, individual patient's characteristics, and the healthcare professional assessment and prescribing references. It is essential to follow the prescribed formulation dosage and administration instructions provided by a healthcare professional to ensure safe and effective use of oxycodone. Pharmacology of oxycodone. Oxycodone is a potent opioid analgesic that exerts its pharmacological effects through its interaction with opioid receptor in the central nervous system. Here is an overview of the pharmacology of oxycodone. Opioid receptor binding oxycodone primarily binds to mu opioid receptor in the brain and spinal cord. This binding activates these receptors, leading to various pharmacology effects, including pain relief and changes in mood and perception. Analgesic effect. Oxycodone provides an effective pain relief by acting on mu opioid receptor in the brain and spinal cord. It reduces the transmission of pain signal and alters the perception of pain, thereby providing analgesia, euphoria, and sedation. Oxycodone can produce feelings of euphoria and sedation due to activity on mu opioid receptor in the brain reward pathway. This effect contributes to the abuse potential of the drug. Respiratory depression, one of the significant risks associated with oxycodone use in respiratory depression. Activation of mu opioid receptor in the brainstem can lead to decrease in the sensitivity of the respiratory centers, resulting in slow and shallow breathing. Severe respiratory depression can be life-threatening and requires immediate medical attention. Gastrointestinal effects. Oxycodone can cause gastrointestinal effects such as constipation due to its action on opioid receptor in the gastrointestinal tract. It slows down intestinal motility and reduces secretions, leading to constipation. Tolerance and dependence. Prolonged use of oxycodone can lead to the development of tolerance, where higher doses of the drug are required to achieve the same level of pain relief. Continued use can also lead to physical and physiological dependence, where the body becomes reliant on the drug and withdrawal symptoms can occur upon abrupt discontinuation. It is important to note that pharmacological effects and side effects of oxycodone can vary among individuals. The dose, duration of use, and individual factors such as genetics and overall health can influence the response to the medication. Therefore, oxycodone should be used under the careful supervision of healthcare professional. Dosage adjustment should be made based on individual needs and response. Medical use of oxycodone. Oxycodone is primarily used as protact analgesic medication for the management of moderate to severe pain, prescribed in various medical settings and be used in following situations. Acute pain management. Oxycodone may be prescribed for the relief of acute pain such as post-operative pain following surgeries, traumatic injuries, or severe pain due to medical procedure. It provides effective pain relief and can administer it on a short-term basis until the pain subsides. Chronic pain condition in cases where the other less potent analgesic or non-opioid medication have not provided sufficient pain relief. Oxycodone may be prescribed for chronic pain management. Chronic pain conditions such as cancer-related pain or pain associated with conditions like osteoarthritis or neuropathy can benefit from the strong analgesic properties of oxycodone. However, the use of oxycodone from chronic pain is carefully evaluated and monitored due to the potential risk of dependent addiction and other side effects associated with a long-term opioid use. Palliative care. Oxycodone plays a vital role in palliative care, where the focus in the managing pain and improving the quality of life for individuals with advanced illness such as cancer. Oxycodone can provide relief from severe pain, allowing patients to more comfortable and enhancing their overall well-being. It is important to note that the oxycodone should be used under the guidance and supervision of healthcare. The decision to prescribe oxycodone is based on various factors, including the types and severity of pain, the individual's medical condition, responses to other treatment, and careful consideration of the risk and benefit. It is essential to follow the prescribed dosage instructions, communication regularly with the healthcare provider, and be aware of potential side effects and risks associated with oxycodone use. Mechanism of action of oxycodone. The mechanism of action of oxycodone and opioid analgesic involves its interaction with opioid receptor in the central nervous system. Here is a simplified explanation of mechanism of action. Opioid receptor binding. Oxygen binds to the opioid receptor primarily to mu opioid receptor located in the brain spinal cord. The binding activates these receptors, initiating a cascade of events that contribute to the analgesic effects of the drug. Inhibition of signaling. Activation of mu opioid receptor by oxygen inhibits the transmission of pain signals. in the central nervous system. It reduces the release of neurotransmitters such as substance P and decreases the stability of neurons involved in pain reception, modulation of pain threshold. Oxycodone also acts as on descending pain pathways which are involved in regulating the pain signals from the periphery to the brain by modulating these pathways. Oxycodone increases the pain and threshold, making individuals less sensitive to pain stimuli. Alter emotional response. Opioid like oxycodone can influence emotional responses to pain. They can produce a sense of euphoria and well-being by activating reward pathways in the brain. This effect is believed to contribute to the abuse potential of opioids. It is important to note that oxycodone affects the primary medicated by interaction with the receptor right, and also interact with other neurotransmitter systems in the brain system such as the dopamine or norepinephrine system, which may further contribute to analgesic and physiological effects. Oxycodone mechanism of action provides effective pain relief, but is associated with potential side effects, including respiratory depression, radiation, constipation, and the risk of dependence of addiction. And addiction, the careful use of oxycodone under the guidance of healthcare professionals is crucial. Balance is analgesic benefits with the associated risks. Here is a uh, pharmacokinesis of oxycodone. Pharmacokinetics refer to the study of how drugs is absorbed, distributed, metabolized, and eliminated by the body. Here is an overview of pharmacokinetics of oxycodone. Absorption. After oral administration, oxycodone is well absorbed from the gastrointestinal tract. The absorption process can be affected by various factors such as food intake, gastric pH, and the specific formulation of oxycodone. The immediate release formulation are rapidly absorbed, leading to a quicker onset of action, while extended release formulation have a slower and more prolonged absorption. Distribution: one absorbed oxycodone is distributed throughout the body via the bloodstream. It can cross the blood-brain barrier and reach the central nervous system where it exerts its analgesic effect. Oxycodone has a moderate volume of distribution, indicating that it distributes well into tissues beyond the bloodstream. Metabolism. Oxycodone is primarily metabolized in the liver by various enzymes, primarily cytochrome P450 and CYP450. Enzyme, particularly CYP3A4, it undergoes biotransformation to produce norooxycodone, oxymorphone, and other metabolites, which may also possess some analgesic activities. These metabolites are then further metabolized and eventually eliminated from the body. Elimination. The elimination of oxycodone and these metabolites primarily occurs through the kidney. They are excreted in urine with the small portion excreted in feces. The elimination half-life of oxycodone varies depending on individuals on the specific formulation and other factors. The immediate release formulation typically have a short life, while extended release formulation have a longer life, around 4 to 6 hours, and half-life around 3 to 4 hours. It is important to note that pharmacology of oxygen can be influenced by various factors, including visual variation in metabolism, drug interaction, liver and kidney function, and other patient-specific factors. It is crucial to follow the prescribed dosing instructions and consult well the health care. आगे आ गया इसके side effects. Here are the side effects and risks of oxycodone. Oxycodone, like other opioid medications, contains side effects and risks. These can vary among individuals and depend on factors such as the dosage, duration of use, individual tolerance, and medical history. Medical history. It is important to note that the following it is the not exhaustive, and some individuals may experience different additional side effects. Here are some common side effects of associated with oxycodone. Respiratory depression. One of the most serious risks of oxycodone use in respiratory depression, where breathing becomes slow and shallow. This can be life-threatening, especially when higher doses are taken or when combined with other respiratory depressants like alcohol or sedatives and sedation dominance. Oxygen can cause sedation dominance and impaired alertness. This can affect a person's ability to perform tasks and require focus, such as driving or operating machinery. Gastrointestinal effects. Common gastrointestinal side effects include constipation, nausea, vomiting, and decreased appetite. Constipation is a significant concern and may require the use of stool softness and or laxatives to manage dizziness and lightheadedness. Oxycodone can cause dizziness, lightheadedness, and feeling of unsteady lines. It is important to get up slowly from a sitting or lying position to avoid falls off or accidents. Nervous system effects. Some individuals may experience confusion, dizziness, headache, or changes in mood while taking oxycodone. Nervous system effects. Some individuals may experience confusion, dizziness, headache, or changes in mood while taking oxycodone. Physical dependence and withdrawal. Prolonged use of oxycodone can cause can lead to physical dependence where the body adapts to the presence of medication abruptly or stopping or reducing the dosage can lead to withdrawal symptoms such as restlessness, anxiety, muscle aches, and sweating and insomnia. Abuse and addiction. Oxycodone has a high potential for abuse and addiction. Misuse or taking higher doses than prescribed can lead to addiction, which is characterized by compulsive drug-seeking behavior and the loss of control over those drug use allergic reaction. In rare cases, oxycodone can cause allergic reactions such as rashes, itching, swelling, or difficulty breathing. Immediate medical attention is necessary if any signs of allergic reaction occur. Reported use oxycodone as prescribed by healthcare professional and to be aware this affects side effects and risk. Regular communication with the healthcare provider and adhering the prescribed dosage can help manage the risk and ensure the safe and effective a use of oxycodone. Current application of oxycodone. Here are some current application of oxycodone. Acute pain management. Oxycodone is commonly prescribed for the management of acute pain, such as post-operative pain following surgery, traumatic injuries, or severe pain due to medical procedure. It provides effective pain relief and can be administered on a short-term basis until the pain subsides. Chronic pain management in cases where the in cases where less potent analgesic or non-opioid medication have no provided sufficient relief. Oxycodone may be prescribed for chronic pain management for chronic pain conditions such as cancer-related pain or pain associated with conditions like osteoarthritis or neuropathy can benefit from the strong analgesic properties of oxycodone. However, the use of oxycodone for chronic pain is carefully evaluated and monitored due to the potential risks of dependent addiction and other side effects associated with long-term opioid use. Palliative care. Oxycodone plays a crucial role in palliative care where the focus is on managing pain and improving the quality of life for individuals with advanced illness such as cancer. Oxycodone palliative care where the focus is managing and improving the quality of life for individuals with advanced illness such as cancer. Oxycodone can provide relief from severe pain, allowing patients to be more comfortable and enhancing their overall well-being. It is important to note that the use of oxycodone is determined by healthcare professional and is based on various factors including the type and severity of pain. Here is the hydrocodone versus oxycodone differences and here we compare hydrocodone with oxycodone. Hydrocodone and oxycodone are both avoid analgesic medications used for management of moderate to severe pain. While they are similar in many ways, there are some differences between hydrocodone and oxycodone, including potency. Oxycodone is generally considered to be more potent than hydrocodone. It is estimated to about 1.5 to 2 times more potent than hydrocodone. This means that lower doses of oxycodone may be needed to achieve the same level of pain relief compared to hydrocodone. Formulation. Both hydrocodone and oxycodone are available in various formulations, including immediate release and extended release formulation. However, oxycodone has a wider range of formulations, including more extended release options, which allow for more controlled and sustained pain relief over a long period. Combination products. Hydrocodone is often available in combination with other non-opioid analgesics such as acetaminophen, or example, Vicodin or ibuprofen, Vicoprofen. These combination products can provide synergistic pain relief. Oxycodone is also available in combination with non-opioid analgesic, but it is more commonly prescribed as a standalone opioid medication. Metabolism hydrocodone is metabolized primarily by liver enzymes, including cytochrome, while oxycodone is primarily metabolized by cytochrome. The metabolism of hydrocodone can be influenced by genetic variations in CYP2 D6, leading to differences in how individuals respond to the medication availability and regulatory status. The availability and regulatory status of hydrocodone and oxycodone can vary between countries. In the United States, hydrocodone is classified as a Schedule 2 controlled substance, indicating a high potential for abuse and dependence. Oxycodone is a Schedule 2 controlled substance in the United States. It is important to note that the choice between hydrocodone and oxycodone depends on various factors, including the individual's pain severity, response to selection, of the appropriate medication and formulation. It is typically made by healthcare professionals based on individuals' specific needs and medical conditions. Future directions Future directions for hydrocodone as oxycodone. Abusive abuse deter and formulation given the high potential for abuse and addiction associated with hydrocortisone. There is ongoing research and development of abuse data and formulation. These formulations are designed to make it more difficult for individuals to misuse their medication by altering their physical or chemical properties. The aim is to reduce the risk of crushing, snorting, or injecting the drugs, which are common routes of abuse. Combination formulation researchers and pharmaceutical companies continue to explore the development of combination of formulation that provide effective pain relief while minimizing the risk associated with opioids. These combinations may include opioid and non-opioid analgesics such as acetaminophen or non-steroidal anti-inflammatory drugs. The goal is to optimize the pain management while reducing the pain opioid exposure and potential side effects. Novel delivery system. There is an ongoing interest in developing novel delivery system for hydrocodone and oxycodone to enhance their therapeutic effects and improve patient adherence. These include the development of extended release formulations, transdermal patches, intranasal formulation, and other innovative drug delivery methods. These advancements aim to provide more control and sustainable pain relief while reducing the frequency of dosing and minimizing fluctuations in blood levels. Personalized medicine and pharmacogenetics. The field of pharmacogenetics aims to identify the genetic variation that influence an individual response to a medication. In the future, genetic testing may play a role in guiding the selection of opioids like hydrocodone and oxycodone. Understanding an individual's genetic profile could help identify those at higher risk of adverse effects or poor response, allowing for personalized treatment approaches. Focus on non-opioid alternatives in response to the opioid epidemic and concerns surrounding opioid use. There is increasing the emphasis on exploring non-opioid alternatives for pain management. Researchers are investigating novel analgesic medication, non-pharmacological interventions, and alternative therapies that can effectively address pain without the risk associated with opioids. This includes exploring new targets and mechanisms of action of pain relief. It is important to note that the future direction of hydrocodone and oxycodone are subject to ongoing research, regularly consideration, and societal changes related to opioid use. The development and adoption of new approaches and treatments will continue to evolve based on emerging evidence and clinical needs and efforts to balance effective pain management with minimizing the risk of avoid medication. Here are the differences of uh, the hydrocodone and oxycodone, and where you can find information about oxycodone and hydrocodone. Here are National Institute of Health, U.S. Food and Drug Administration, Drug Bank, Medline Plus, and there are some references of oxycodone and oxycodone from Wikipedia, National Library of Medicine, Drug Bank, National Library of Medicine, and etc. Thank you. Here is my topic is ended. So thanks for listening, and please also subscribe the channel. Bye bye.